Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Dr. John Brock Harris about his upcoming presentation titled Neonatal Pharmacodynamic and Pharmacokinetic Characteristics and Implications for Pharmacotherapeutic Decisions. So, Brock, welcome. Thank you for being with us today.
Thank you for having me.
Well, we are very excited to have you as part of the conference. So, to start with, maybe you can tell us a little bit about yourself and your professional journey.
Well, I grew up in the eastern part of North Carolina on the eastern seaboard of the United States, in a small town, and got involved in pharmacy as a 16-year-old as the delivery boy from at a mom and pop pharmacy, and have kind of worked through it as a technician, in the pharmacy program through my undergraduate career, and then pursued pharmacy into the pharmacy program. Did some postgraduate training where some of that interested me in the pediatric population, and now I currently practice as a neonatal pediatric clinical specialist, as well as a professor of pharmacy in pediatrics. And so those are some of the things that I enjoy. Now that I have two children, this discipline means a lot more to me. I have a personal stake in it now, so I really enjoy that.
Wow, so you got to start really, at a young age with this. I love that little story about the fact that this all started when you were 16. That's amazing.
Oh, yes, I've been at it for a while, I guess.
Well, that's fantastic. So, perhaps you can tell us a little bit about your topic. I know that, medicine is, medications and pharmacology, it's one of those areas where information is always changing as we get new research. So perhaps you can tell us a little bit about your topic and why you feel it's important for professionals working with neonates to have an understanding of your topic.
So my topic deals with pharmacodynamic and pharmacokinetic changes in neonates as they develop and grow older. These processes and these characteristics principles are kind of important to me, and I've been interested in them for a long, long time. My undergraduate degree is in chemical engineering, where we talk about pharmacodynamics and kinetics, not necessarily pharmacokinetics and pharmacodynamics, but dynamics and kinetics. And so this topic has been of interest of mine for a long time. Um, as pediatric patients grow from neonates all the way through adolescence, there are some developmental changes, and these dynamics and kinetic characteristics do change. Those changes impact medications, on which medications we utilize and which medications we may not utilize, how we dose medications differently across this age spectrum. These kinds of things make it important for professionals working with neonatal populations to understand that there's even a difference between preterm and term neonates in some of these characteristics and principles. And so it's kind of important to understand those changes so you can have an understanding of the medications we do use and medications that may be coming that we may use. With this core group of principle understanding, it allows for new drugs and new options of drugs, and better dosing strategies, better monitoring strategies, and the importance of those.
Okay, thank you so much. Perhaps you can tell our delegates just a little bit about what you hope they're going to be able to take away from this presentation and take back with them to their own practices.
So one take home point, it's kind of global. I just mentioned it a second ago. It is understanding that there are differences even in our small population, our neonatal populations, from preterms to term neonates. There is that difference, and it does play sometimes a larger impact than others in the drug selection and the drugs that we actually use. So that's kind of the global take home point. Some of the smaller take home points is an understanding of medications that we've used for a very, very long time, why those dosing strategies are actually used. And we have even tweaked some of those dosing strategies recently in some of our drug reference materials. The dosing strategies have changed from 2013 to 2015 on the medication that we've used for nearly 50 years. So understanding these changes is important and should be a take home message. So I'm hoping to lay the foundation that we can build on moving forward at your practice.
Okay, thank you so much. So For all of our delegates who are listening, you will be able to hear more from Dr. Harris during his presentation titled Neonatal Pharmacodynamic and Pharmacokinetic Characteristics and Implications for Pharmacotherapeutic Decisions, which will be available as part of the Neonatal Pharmacology add-on package. Thank you so much for listening. Bye for now, everyone.